Meinrad's going to present the situation in Germany, one of the key countries particularly active in improving access to medtech innovation. Can you tell us the current state of play in Germany and about proposals to further adapt the regulation short term to address some of the challenges presented earlier and which are well summarized in the reports?
Yes, I will show you some facts later on in my presentation.
Lovely.
At the state of play, what we see is that... Oops, sorry.
Oh. Sorry, just also... Meinrad, I'm aware you have 11 pages in your presentation.
But I'm fast.
Good.
Now, what we see as the state of play is that the question of keeping your products on the market and be innovative is linked. So we have to think about both topics when we talk about regulation, but I will show you the figures later on. So I will start with my presentation, if you don't mind.
Could we have the presentation?
So perhaps not everybody knows Medical Mountains, so just two sentences to us. We're a cluster management located in southwestern Germany, in Tuttlingen. This might be known because there are many companies located there. And we're an independent, we're not an association, we're an independent organization, self-financed, and our shareholders come from the public sector, from craft and research and science. Now, that's what we would consider the state of play. It's a assessment we made with partners. It was published in December 23, and we see a lot of figures. We don't have time for every single one, but as I mentioned, there are difficulties to keep your products on the market, and there are difficulties to bring new products on the market, and we have to find a solution for both. So we have 5 columns we're working on, and today I'm focusing on the first one, representing interest, because we have published a position paper in July. Now, the paper is not written by ourselves. We have a great network that helped us, about 30 manufacturers, many SMEs in there. And what was important for us, it's not the first position paper. There are a few on them have been published the past months or years. But we want to focus on swiftly implementable measures that can be take force within months very swiftly. So I think this is not new, what we heard today. The 3 biggest problems: unnecessary burdens that are not connected to safety and performance, costs that do not reflect not in proportion to the product, and the lack of predictability in terms of money, in terms of costs and time for manufacturers. So there are many points in these position papers. I just pick out a few to show you what we think can be managed within a short term of time. For example, talking about clinical data or certification, the certificates, is it really necessary to re-certificate every product every 5 years? Once it's on the market, you have a strong survey by notified bodies, you have your post-market surveillance, so we can say if it's on the market, it's certainly well controlled, and it's not necessary every 5 years. In the same way goes simplified design for clinical evaluation of low-risk class medical devices. Once you have it 4 or 5 years on the market, you get your data, and you don't have to you don't have to have a full CEP, for example, or your PSUR reporting may, the interval will rise from up to 4 years, for example. Also, there are some what we think important questions regarding the equivalence principle, which is no longer practicable under the MDR up to our point of view. The EIF view is something that is very important for our network that should be fostered in the next sooner than it is right now, and for a wider, for more medical devices than today. And of course, digitization of the system, approval, for example, is a key factor for our network as well. Now, EUDAMED is coming a lot faster than expected, so we expect as well, once EUDAMED is fully functionable, there are no more national databases to be filled, because this is double work for manufacturers in our eyes. And as well, when we talk with our network, notified body is always a topic, and this is perhaps something that will take some time. It cannot be solved within half a year, but we should introduce a total cost model, binding deadlines, for example, response within 6 weeks to the manufacturer. And helpful would be also an MDR office to harmonize the requirements, and also to be a place where you can ask if you're discussing with the notified body about a certain topic right now. There's no place where you can find a solution for one specific question. It's always up to the auditor or the notified body. So that would be helpful as well. Now, what are the questions that have to be answered? Not only by the industry, not only by the stakeholders, not only by the European Commission, but from society in Europe. Where should innovation take place? In the EU or in the USA, somewhere else? How long should it take time that innovation come to the patient? And how resilient wants Europe to be in terms of healthcare? When we're losing medical products, when we're losing innovation, we're creating new dependencies. There are 2 QR codes you might like to scan. These are you can download the full survey and the position paper. And I guess there's a lot to discuss afterwards.
Yeah, a quick question. When was that position paper drafted and the key solutions?
Mm-hmm. It was, the first beginning was in December.
Right.
Then we had the new regulation on European basis, 2017, 2018,
yes.
New timelines. But we had a visit. It was some members of the Commission, DG Santé, went to Tuttlingen for a fact-finding mission, and that was in June, I guess.
June which year?
This year.
This year?
Yeah.
Okay.
So this was the point when we decided now it's necessary to bring this all to paper.
Yeah. Okay, because it's very interesting, because those key solutions that are there, I think almost every one of them is also in Peter Liese's initiative. Mm-hmm. So, and I know that Germany has been very active in pushing that.
Indeed, as I said, there are many position papers, there are many activities, but it's important that every voice, that everyone speaks up.
Yes.
More voice, perhaps more effort, and more success, maybe.
My observation is everybody is singing from the same song sheet and saying the same thing.
Mm-hmm. But yeah, definitely.
Yes, a straightforward message for the European Commission. I have a question. I understand that Medical Mountains recently also joined the NoboCap community. While you have already done some great work, what in the community is of interest, and what would you like to see as one of the focus areas in that community?
The focus areas is, for me and for our network, it's not only software innovation. It can be innovation also with surgical instruments, with hardware, with implants. So don't forget that the variety of medical devices is quite large, and also the potential for innovation. And what is important for us, in the beginning, the MDR was regarded as it's just a problem for the industry. Mm-hmm. They earn less money, now they're howling like the wolves. But now we see it has an impact on the patients, on the healthcare system, and not only for the members, not only for the states with a strong industry, but for the whole European community in each and every country. From Finland to Malta, doesn't matter. Your patients maybe do not get the best treatment because they are not innovative products or legacy products, for example.
Yeah, very true. Thank you very much, Meinrad. Appreciate your input here.
Thank you very much.